friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, the topics are given in a systematic order. Now in the last few classes, we are discussing about Asperger's syndrome. Probably today we'll sum up it. And the criteria 3 for the diagnosis of Asperger's syndrome is the symptoms must be present in the early developmental periods, but may not manifest until the social demands exceed the limited capacities or may be masked by the learned strategies in the later life. Okay, so for the diagnosis of Asperger's syndrome, symptoms must be present in an early developmental period. Sometimes it may not manifest until the social demands exceed the limited capacities, or they may be masked by the learned strategies of the later life. Later life, you know how to tackle this without communicating with anybody. So you will do by yourself. Sometimes in kids in the primary school, they hold together socially. In the primary school, so teacher try to hold together everybody socially. But when they get into the high school, so they will have the problem. What actually happens in the primary school, teachers are very much in relation with the kids, and by forcefully or by one or the other way, they will keep all the students together, get socialized by different activities. But when they enter into the high school, so you may face some of the problem, because life is now very much complicated when you go to the high school and pre-universities and all. So because they have so many toxic teenagers, we use the word toxic teenagers who are troubling, teasing, bullying, etc. So because they will have some toxic teenagers in their life, so they may feel some of the difficulties. Now coming to the criteria 4, what is that? Symptoms cause clinically significant impairment in the social, occupational and other important areas of current functioning. If this is present, then we will say criteria 4. And this is one of the criteria for the diagnosis of Asperger's syndrome. What is that? If the symptoms which are present, symptoms of Asperger's syndrome which is present, if they are clinically significant, if they are causing clinically significant impairment in either social, their occupational, or some other important areas of current functioning. Suppose I am doing work in some police department, etc. So because of my Asperger's mentality, so I will have some problem there in dealing with the citizens. So then if it is there, then I will say yes, this is criteria number 4, which is help for the diagnosis of Asperger's syndrome. Now, what do you mean by clinically significant impairment? Okay. So there is a personality called as Asperger's personality type. Asperger's personality type. This looks like a personality problem. And Asperger's personality type. This is also called as border autism phenotype. Not exactly autism, but somewhere some of the symptoms are mimicking with the autism. And if we say, that means interestingly, such Asperger's will have noble profession. As I told earlier also, in the earlier class also, because their area of interest is very much focused. So now many times they may be having noble profession also. It depends upon for how many years they keep this interest on the same field, maybe to the decades, maybe 30 years, 40 years, etc. So they will have noble profession like engineers, accountants, information technology, and also the medicine, and so many people in the cinematography. Okay, so because actually one more name which is given for this Asperger's syndrome is they are also called as little professors. Why this is called as they are called as little professor is their attitude is just like professors. So the professors usually talk less, and professors usually they are very expert in identification of the fault. Okay, very simple and minute fault also they will identify. Okay, so suppose you have written a thesis, a professor, so rather than appreciating your thesis, what you have done, usually a old professor, so he will try to find the mistakes. Of course, that's good. He tried to find the mistakes. Similarly, in Asperger's kid also, although he talks less, but is very good in identifying the mistakes. So where actually you are doing the mistakes. So this is quite good as far as cinematography is gone. So directors, these cameramans, and so many editors and all. So they identify the mistakes very early and promptly. So that helps in perfection. Okay, similarly in the other field also. So therefore, this Asperger's kid is also called as little professors. Okay, little professors. They talk less and they identify your mistakes and they're very particular about the mistakes and small mistakes. Okay, that is one thing. Now, progression beyond the clinically significant impairment. Now, the clinical experiences and 3 longitudinal studies suggest that about 9 to 15% are become subclinical. Okay, this is what the research study says. Example: suppose a child was at 3 years of age. He looks somewhat socially isolated. So this is a longitudinal study. Okay, one of the study conducted longitudinal study. See how much time it is required usually to take to identify the Asperger syndrome. See this study start from here 3 years. In the 3 years when they are observed, this child was actually socially isolated. He is not talking with anybody, only restricted, only limited talk. Okay, and at that time he was screened. Then he become adjustable and little social. At the teenagers comes. Okay, so somewhat he managed how. Then when we come to the teenage, again he will have some problem in making the friends and all. But he is able to adjust, no problem. Then he became a police officer. He wrote some exam, became a police officer. He is very strict in his routine and he has got some morality also, and he is also dedicated to social justice. So he wrote the exam and a letter from the police department came, send this kid to the pediatrician to screen for the Asperger syndrome. Now pediatrician does the screening test on the basis of the points and found he was not actually Asperger's. Okay, now he joined the police department as a police inspector. After a few months of joining in the police department, he has started feeling uncomfortable with that particular job because police department need a lot of social communication. He has to interact with many people. Now he starts feeling uncomfortable when the people come and giving their complaint and seeking help from him. He now start feeling uncomfortable because he is not able to communicate. So what happens? Then he left the job and he shifted to the Navy. After 3 months, he quit the Navy job also because in the Navy ship, there are so many other soldiers. They have to be in group. Again, he is not comfortable there. And now he is doing the psychology. Again, he left the job and now he is doing the psychology. So many times, see, such longitudinal studies are required. Now, after so many 20 years or 25 years, identified that this person has got Asperger's problem. I hope you got this point. So many times it is not diagnosed. Similarly, language is a monologue, as I told earlier, and there is no seeking of repair of the conversation. They always find out the smaller and minor mistakes in you and others, although they don't want to pointing out their mistakes. If you point out their mistakes, they will get upset. So they talk about hours together in the field of interest, just like a little professor. This is the word I used. Okay, professors always, in most of the professors, so they used to talk in their own field of interest, along with that skill of identification of the mistakes very common promptly. They also like to talk on the area of their interest. Therefore, the name is given a little professor. But they will have problem with making the phrases, sentences, etc. And that is one of the reasons that they are good in mathematics. It is all about the patterns and there is no problem of by-hearting. So usually such kind of kids, so they are very good in mathematics and computer science and other engineering and all because not much by-hearting is required. Okay, so only the application of the skill is required, isn't it? By-hearting and repetition and reciting, so these people will have the problem. Now they are clumsy in walking. There will be unusual gait sometime, and their handwriting is also very terrible many of the time. And handwriting is because they don't write, they don't want to improve the handwriting, or they don't write with the beautiful letters because they think that writing so beautifully is a totally time waste. So this is their thinking. So noticing the objects and the facts rather than the thoughts, feeling and intentions. Now suppose a girl has her hands on the jar, suppose an example. Yes, holding a jar, and Asperger's boy came there and his hand is on her shoulder, okay, and looking at something, and suddenly he is totally unaware that, see, that girl is also unknown to him. He came from somewhere and he's looking somewhere. In the meantime, he keep his hand over the shoulder of that girl. For those who are looking, it is looks very odd, but for that kid, that Asperger's kid, it is normal because he don't know that he's making that. Okay, so suddenly he come to know that, then he suddenly draw. So these are some of the behavior of these kids. Now, actually, diagnosis in the girls and women, this is quite important because Asperger's girls will have much problem. Okay, so most of the time this syndrome is left undiagnosed in girls or diagnosed at the high school level. Okay, the invisible end of the spectrum, the fly under the radar of a diagnosis. Now, girls are smarter and more creative than the boys in coping with the differences. In reciprocity, boys usually turn away and no reaction or ignorance or intrude. But girls go for another option. They say, okay, I will observe, etc. So what she is wearing, like pink dress, pink, like this. So they observe everything and analyze and imitate. The profile of abilities in the girls, so they live in the world of imagination. So reading the fiction or watching the soap operas helps them to learn about their inner thoughts and feelings. Many of the girls with the Asperger's don't have the female friends and they are tomboys. Okay, so she thinks that boys are funny, girls will tease one another, so she like the boys. So this is possible in case of girls. So girls usually decode the social situations in deal play and talking with imaginary friends, and also applies and appease. So compared to the boys, they will adjust to the situation and resist less. Girls will resist less, and so things left undiagnosed. So it is a type of torture actually for the girl, because especially at the time of the marriage and all, suppose so they have to select their partners, and partners, so now they have to communicate together. Okay, the girl who is Asperger's girl, so now she want to talk with her partner before engagement. Now what happens is she is not able to communicate there, so she is not able to convey her feeling, and what parents think that yes, girl is agreed for this, so she will keep quiet because she is a problem in communication, keep quiet. And what fathers, parents think that girl is agreed for this marriage, and the marriage is also over now, and after the marriage also she will have the same problem of communication with the husband, and the husband think that yeah, my wife is very less talkative, it is very good. So like this they will suffer more actually. Okay, so Asperger's girls, they left undiagnosed. The reason is their adjustability is more, they adopt all the skills. Okay, they shows less resistance for this type of activities, so unfortunately it's left unnoticed. Okay, so these are some of the important aspects related to Asperger's syndrome. So now we have completed two important disorders. One is autism, another one is Asperger's syndrome. One more disorder in autism spectrum disorder, so that is Rett syndrome, that is left. That we will do in the next class. Thank you very much. Afterwards, we will see what is the Ayurveda approach of treatment of autism spectrum disorders. Thank you very much for being with me. Please don't forget to subscribe my channel, and also please give your valuable comments.